Next, we've got Jonathan Fluxman. Hi, Jonathan. Talking about declaration in respect to health and social care. Thank you, Jonathan.
Thanks so much, Leslie. Yeah, I'm just blown away by those contributions. Thanks so much, guys, for speaking out, for your honesty and bravery. It's truly humbling. And every time we have meetings like this, and I give talks to trade union branches and stuff, the anger and the pain and the sorrow just wells up all over again. And I think it's so important that we channel those or try our best to do so. And I'm reminded of something that a Canadian doctor said at a meeting a short time ago. And he said getting involved in advocacy is actually therapy for what we've all gone through. Because when we get together with others who share those experiences and that pain and suffering, it does make us stronger, and that sense of solidarity does really help. But it doesn't obviously take away the burden itself. And just a word to you all about the length of time for the speeches. I think you've done a wonderful job getting it all into 5 minutes, but I think next time we should perhaps give people a bit more time and maybe have slightly fewer speakers, so we've got a little bit more time so people can actually say their piece. Okay, so the declaration. Yeah, I think most people are probably in the morning session, so I'm not going to go over everything all over again, but in brief, it's in two parts really. The sort of introduction, and then the need to be explicit in what we want, both in terms of our demands and then practically what we want from our employers, and in this case, definitely within the health service. But in two sort of groups, really, two areas. It might be helpful to think about it in this way, but obviously it's not a requirement. But as health workers and then as patients. And also to think about how we can work together, making common cause between patients and health workers, because I think that alliance will be much more difficult for the trusts and the employers to resist, working not in isolation, but separately, we can get quite a lot done. But I think together, we can be much stronger, both as sort of consumers, if you like. I shouldn't say that, it's an NHS. As patients who need healthcare service and as healthcare workers who provide it, we both need to be kept safe, and we should band together and demand what we really need. So in the breakout rooms, if you can please just bear those thoughts in mind and reflect them in the discussion so we can capture them for the declaration. But also to think about, well, should we set up a group of healthcare workers, say, who want to work together as trade unionists, health and safety reps, or even if you're a workplace without an organized union, come along and maybe we can progress the work in that way. And similarly with patients, if we should set up a patient group. But I don't want to suggest for a moment that the other groups out there are not doing a good job. They are indeed, and they're doing a great job, and we don't want to duplicate things. But if there are practical campaigns, for example, like Stuart, what you're doing in East London, a campaign specifically around sick pay in relation to COVID, that's very focused, and maybe people can sort of get together around that. And as patients, maybe demanding air filtration in every outpatient clinic, as Sarah has managed to achieve in her local trust. Okay, I think I'll stop there, and thanks again to everybody who's contributed. It's really been humbling.